In this video, we'll have a look at the internal anatomy and the overall structure of the heart. So here we're starting with the heart that's been opened up and the frontal portion has been removed, and we can see many of the internal structures. Let's start by getting just an overview. So over here, we're on the right side of the heart, and this is the right atrium. This is the right ventricle, and you can see that its outlet heads up into this direction. Over here is the left atrium. Now, you don't get a great view of the left atrium here because much of the left atrium is actually on the posterior surface of the heart. And from there, we can see the left ventricle. Now, let's start by looking at ventricles. And, of course, ventricles, we can always tell we're looking at a ventricle because there are some distinctive structures. And one of the most distinctive structures we can see are these cords. And these are the chordae tendineae that were made reference to in a previous video. And you can see the chordae tendineae come up and attach onto the valve. Now this flap is part of the structure that makes up the valve between the atria and the ventricle, so it goes by the name of the atrioventricular valve. And in this case, it's on the right side, so it's the right atrioventricular valve. Over here, we can see that we're in a ventricle once again because of the chordae tendineae. And this is another of the atrioventricular valves. It's on the left side because here is the atria up here, ventricle down here. So this is the left atrioventricular valve. Now, just a heads up, these valves have numbers of names that are used interchangeably, and we'll have a look at some of those down the road. Once again, we can see the chordae tendineae, and the chordae tendineae attach onto this uprising of muscle, and it's the papillary muscle, so we can see papillary muscle throughout here. So those are some very distinguishing characteristics of the ventricles. Now, once again, looking at the ventricles, we can see that the right ventricle, the myocardium is quite thin here versus the left. And of course, that has to do with the right ventricle is going to send blood out to the lungs, which are right next door. And the lungs, remember, blood flow is high volume but low pressure. So you don't need a whole lot of muscle here to basically get the blood to head off to the lungs. Up here, we can have a look at the right atrium. And in the right atrium, we can see that there are ridges. These ridges inside here are called the pectinate muscle. And another structure we can see right here is the fossa ovalis. This is a shallow depression. Now, originally during fetal development, this was actually a flap valve that allowed blood from the right atrium to cross over to the left atrium. Because, of course, a fetus does not have to use their lungs for oxygenation because they're getting oxygenation through the placenta. Now, the septum, septa is wall. The septum is the interatrial septum. And not surprisingly, down here, we can see the interventricular septum. And we're going to come back and talk about these because the electrical conduction system is associated with these structures. Okay, so blood flows into the right atrium through the superior vena cava from higher structures in the body and the inferior vena cava from lower structures. Once it's in the right atrium, of course, it moves to the right ventricle. What causes this? Remember, things go from high pressure to low pressure. From the right ventricle, it then exits through the pulmonary valve and it heads off to the lungs. Coming back from the lungs, the blood is collected through the pulmonary veins, and the blood enters at the back of the heart. We can't quite see the view, but we can see a little bit of the left atrium here that will fill with blood. And the blood then travels down into the left ventricle. And from the left ventricle, it exits via the aortic valve. And the aortic valve, the blood will travel. You can't quite see it because it's obstructed by other structures. And travels into the basically aortic arch, and from there it's distributed to higher parts of the body or off to the rest of the body through the aorta itself. These are some of the main structures that you can see from here. Now there is one thing I didn't point out, and that is the trabeculae carnae. Up here we had ridges, which were the pectinate muscle, and we see those in the right atria. Down here you can see that looks like there's sort of bigger ridges, and these are the trabeculae carnae. The valves and the lining of all the chambers is made up of endocardium. So we see endocardium that lines all the chambers and also associated with the valves. And actually the endocardium is continuous with the lining of the blood vessels. And if we look at from outside to inside in the heart, the layers are the epicardium, the myocardium, which is the actual muscle layer, and the myocardium, and then the innermost layer, which is the endocardium. So that's just a quick overview of the internal structures of the heart. Now, the one thing I wanted to look at is this diagram to point out that as we look at the left ventricle versus the right ventricle, they have a different shape. You can see the left ventricle is much more circular, and if we cut away the muscle, we'd see it's much more like a column shape, a tall column. Whereas if I look at the right ventricle, what I see here is it's almost like crescent shape. And of course it heads down into the tissue this way and up that way a little bit. Now, the two ventricles, even though they're different shapes, they do pretty much have the same capacity for volume. Because think about it, I have to have balanced outflow from the right and the left ventricle with each heartbeat because the circulatory system is a closed system. So despite the differences in the way they look, they really do occupy similar volumes. Okay, we'll end the video there, and the next one we'll have a look at some other structures.